You don't want to put off having your mammogram because annual mammography saves the most lives. The guidelines that we follow here at the Northwell Cancer Institute are to start having a mammography at age 40 and to come every year. The thing that we value the most highly is lives saved from breast cancer. I think the biggest reason that women are not coming in right now is because they are off schedule in their lives. You know, COVID threw everybody off schedule. And there's a lot of reasons why people haven't come back. I think it's important for people to know that it's safe to come and have your mammogram. The initial delay that people had, where maybe they paused for 2 or 3 months, we don't want that to turn into a year delay, because we know that a year means that we could find a cancer that's larger than it might have been, that may be harder to treat than it might have been. So breast cancer occurs in every decade. I think a lot of people think of breast cancer as something that happens in middle age or even later than that, but the truth of the matter is there isn't a decade where we don't see breast cancer. And it comes as a surprise to a lot of people when I tell them that 1/6 of all breast cancers actually occur in women in their 40s. We see a lot of women in their 30s or even in their 20s who have breast cancer. That's not to say that most women in their 20s or 30s are at risk for breast cancer, but some are. And really the best way to know that, again, is to do a risk assessment, to know about your family history, genes that may run in your family, other risk factors that you may have. You know, we talk about the average risk woman having a 1 in 8 risk of developing breast cancer, and how for her the best recommendation is to come in at age 40. But the truth of the matter is that not all women are at average risk, and some women, and we're increasingly realizing that that includes young Black women, are at increased risk for developing breast cancer. They tend to occur earlier and to be more aggressive. Black women tend to have a higher incidence of the triple negative breast cancer, which is a more aggressive kind of breast cancer, or to carry the BRCA gene. So for many reasons, they can be at an increased risk for developing an aggressive form of breast cancer. For that reason, we're telling all women, especially Black women, that they should have a risk assessment by the age of 30, because it may be that they need to start getting screening earlier, and they can't wait until they're 40. You know, a lot of women will tell me that they're putting off having their mammogram because they're trying to get pregnant. And in fact, it's a really important time to have your mammogram because of the hormones that you have during pregnancy and during lactation. Some breast cancers will actually grow faster during that time period. Mammography is totally safe while you're trying to get pregnant, totally safe during pregnancy, totally safe during breastfeeding. So it's not a time that you want to pause in your breast cancer screening. For some women, mammography is not going to be enough. Half of all U.S. women have dense breast tissue. Dense breast tissue is normal. It's just a normal tissue pattern. But the problem with dense breasts is that they can make your mammogram harder to read. They actually increase your risk for developing breast cancer. And you can't know if you have dense breasts. It's not something you can feel. It's not something your doctor can tell you. The only way to know if you have dense breasts is by having a mammogram. And if you do, you might want to have supplemental screening. Most breast cancer is curable, and the reason not to delay your mammogram is you want to find breast cancer when it's the smallest, when it's the easiest to treat, so that we can cure it using the least aggressive and invasive means possible, with the least aggressive surgery, with the least need for aggressive treatments, and then you're going to be able to go on with your life. Women are really, in many cases for their family, the drivers of healthcare. They're the ones who both set the example for healthcare. They're the ones who, in a lot of cases, are making the healthcare decisions for their family. And so I think it's really important that they both behave as a good role model for health, and also that they take care of their health so that they can be there to support the health of their family.